When you look at how much news there is out there that actually we could have a vaccine by the end of the year, are you worried that it won't be safe, or are you worried that even if it's safe, people just don't want to take it?
Right now, my bigger risk is the latter, that there'll be so much confusion around the vaccine that by the time that it's approved, people will be wondering whether it's safe or not. I have more confidence that the studies are the right ones and that the regulators will be careful in deciding what to make available to people.
What are these vaccines? Are the vaccines, a part of just enhancing a vaccine that has developed in the past? Would that reassure people that take it?
These are very different vaccines than ones that are in the past, and I think it's really important for the regulators, for the scientists, the public health officials to be talking about them really on a daily basis now with the American people, with people in their own countries, because people have a lot of questions. We should be answering those questions. It's pretty unfortunate that so little about the studies is coming out from the officials. Instead, it's like little tidbits of information are coming out from like investor calls and company press releases. And I think that is contributing to the confusion about what's happening.
But Dr. Sharfstein, would you expect a regulator to do a daily or weekly press conference to make people aware of what they're doing, or would that be even more confusing? Because most of us don't understand how vaccines are made. We don't understand. We're not virologists.
I mean, I don't think you have to do something at a graduate scientist level of training, and I think that the agencies both could be doing press conferences and could be making materials available, answering people's questions. The basic concept of the vaccine, to explain that, to explain, thousands and thousands of people in these studies, some of them getting the vaccine, some of them not getting the vaccine, how methodical they are about collecting adverse effects, and how they'll check to see whether the vaccine is really preventing serious cases of COVID. All those things could be explained. I don't think they're really well known, and I think more clarity about that would help people. And that information would sort of just drift out there. People would talk to their friends. They would understand more. People could sort of follow these and understand also, I think, that not every piece of news is going to be good news. Some of these vaccines won't work. But if you're not prepared for that, then it may seem like all vaccines don't work. And that also could be pretty confusing.
Dr. Sharfstein, what do we know about how the government process is going ahead with this? Again, do we need more transparency just from governments to see how much pressure they're putting on companies?
I think there should be more transparency. One of the things that would be helpful would be to understand a little more about the protocols, about the rules that have been set up for stopping the trials. And then when we're a little further along, there really needs to be a lot of transparency about what the data show and on what basis there's a recommendation coming from the regulatory agencies to authorize or approve a vaccine. I think, we're past the point that people will just trust a decision without any real explanation behind it. And I think the good news is in the U.S., the FDA is definitely moving in this direction. They have said there'll be an advisory committee, but it would be better, in my opinion, for the agencies to start showing that level of transparency now with the things that are in front of them.